Knock, knock.
Come in.
Good afternoon. My name is Cheyenne Thomas, and I am a nursing student. Can I get your name and date of birth?
My name is Madison Newport, and my date of birth is 4/29/05.
Okay, great, Madison. Do you prefer to be called Maddie, Madison?
Maddie.
Maddie, great. Do you have any allergies, Maddie?
Cats.
Cats? What happens when you are exposed to a cat?
My nose gets really stuffy, and I get itchy, and my eyes get watery and puffy.
Okay, have you ever had to be hospitalized for that?
No.
Do you normally just take medicine and Benadryl
Yeah.
for that? Okay, and that takes everything away?
Yes.
Awesome. Do you have any other allergies? Okay, good. That's good news. Today, my goal is to complete a musculoskeletal exam, so that's involving checking out your muscles and your bones. Just do some different like exercises type things. That's going to involve me looking at your muscle development, the way that you move and things like that, feeling for any deformities, and then also having you, like I said, do some different exercises like range of motion tasks.
Okay.
You might look a little silly at some point, but that's okay.
Okay.
I'll also be applying some resistance, so
Okay.
that'll be tested. Does that all sound like it's going to be okay for you?
Yes.
Great. If at any point anything hurts or feels tender, like just maybe not like a pain, but it's not comfortable, let me know. That's the purpose of this exam, okay? Great. Before we begin, do you have any specific spot that you want me to be aware of?
No.
Okay, good. So general assessment, patient is an overall good hygiene 14-year-old female. She appears to have no respiratory distress, no obvious signs of pain. She's sitting in an upright position. She's awake, she's alert. She's got hair evenly distributed, evenly pigmented. No signs of like malnourishment or obesity. Muscle development appears to be good. No obvious signs of deformity or no obvious signs of scoliosis or anything like that. All right, Maddie. So before we begin the actual assessment, I'm going to ask some questions and just answer to the best of your ability, okay? The first thing I want to ask is, do you know if you have any history in your family of bone disorders or diseases?
My grandma on my dad's side has a bone disease. I'm not sure what it's called.
Okay, but
I know she has one.
All right.
So.
What exactly happens? Do you know?
Her bones get like wide. Like, for example, her knuckles, like they get really thick.
Okay. Yes. Okay. Great. Do you know if that started when she was younger or when she was older?
I think it started as she started to get older.
Okay, that sounds like it. Do you know of anybody else in your family who has anything like that?
No.
What about any like muscle disorder or anything like that?
I think so.
No? Okay. Anything else? Any other family history that you think is
No.
important? Okay. For you personally, have you ever broken a bone before?
No.
Have you ever sprained a bone?
Yes.
Which ones?
My right wrist.
Your right wrist, did you have to go to the hospital for it?
No.
No surgery?
Mm-mm.
Okay, and then did it heal normally? Does it work
Yeah.
now? Okay, good. How long ago was that?
A while ago.
Like years?
5-6 years.
Okay.
So
What happened? You fell out of a tree? What
I
happened?
was skateboarding.
You were skateboarding and
Yeah.
you broke it? Or you sprained
I
it?
sprained it, yeah.
Okay, well I'm glad that that healed nicely. Anything else that you've injured?
No.
No? Okay. No tendons or ligament injuries? Nice, that's good. Have you ever like pulled a muscle or anything?
Yes, I pulled my hamstring before, which sucks.
Yeah.
And then I don't think I pulled anything else.
Okay.
I think it was just my hamstring.
And that recovered fine?
Yeah.
Nice. Do you exercise often?
No.
How often would you say you exercise?
Like once every other month.
Once every other month. Okay. When you do those exercises, are they heavy weightlifting? Is it running?
No, they're just body weight exercises.
Okay, that's good too for our joints. And you said every other month. What is your diet like? Do you eat good foods?
Sometimes I eat sort of healthy dinners, but
Okay.
most of the time I just eat like junk.
Like chips?
And soda.
Okay.
I do drink a lot of water. So.
You drink a lot of water? Okay. Do you eat meat?
Yes.
Yeah? What kind of, like chicken, beef, all of it? Nice. Vegetables every once in a while?
Kinda.
Okay, with those dinners?
Yeah.
Fruits?
Yes.
Okay, good. You're young, so you got some room, but we better get on that. All right. Well, is there anything, like I said, that you, any bone formations or anything that you've been worried about? All right, then we are going to go ahead and just get started. First thing I'm going to have you do is I'm going to have you stand up for me. Is that okay?
Yes.
All right, I'm going to go ahead and have you turn to the side. I'm going to look at your back here. And I'm just looking at your spine, And your spine seems to be midline, and it is upright. There's no excessive scoliosis, no excessive kyphosis or lordosis. That's like weird curvature of your spine. Doesn't appear to have any of that. I'm going to go ahead and palpate, which is going to be touch. Let me know if anything's tender. Is that okay?
Yes.
All right. Does anything hurt?
No.
Anything feel just kind of weird?
No.
No. What about down here?
No.
Okay, I'm going to go a little bit lower, okay? Anything down there?
No.
All right. No paraspinal tenderness upon palpation. No obvious deformity. Like I said, no scoliosis, anything like that. It seems to be all in line. Your muscle development is good and even throughout, so that's awesome news. That's your cervical, thoracic, and lumbar spine. We're all seemingly good. Next, I'm going to test the range of motion of your cervical spine, okay, which is like the neck portion. I'm going to have you drop your chin all the way down to your chest. Good. Look up to the sky, and then I want to have you drop one ear down to your shoulder. Next one. And can I have you like look over your shoulder. Good. This is going to be testing your flexion, extension, your external, internal rotation, things like that. Did you have any pain with that?
No.
Good news. Full range of motion of cervical spine. No tenderness. No obvious, difficulty or anything like that. Great. Next thing I'm going to have you do, I'm going to have you bend all the way forward with your spine. Okay. I'm going to go ahead and take a look here. Yeah, spine is in the midline. It's straight, which is good news. The regular curvature. Was there any tenderness when you did that?
No.
I'm going to have you go all the way back as far as you can. Good. Good job. Now I'm going to have you drop to one side. Okay, drop to the next. Great, and then can I have you look over as if you were looking over? Okay. Is there any tenderness with any of that?
No.
No pain?
No.
Awesome news. Full range of motion of the lumbar and thoracic spine. Everything looked and appeared good. Your ear is in line with your shoulder, and then I'm going to have you just drop. Your shoulder is in line with your elbow. Elbow is in line with the hip, in line with the ankle. The wrist is slightly anterior to the elbow, but it doesn't seem to be of any concern. So that's all good. Nice and straight. I'm going to go ahead and have you sit down, and we're going to go ahead and test like your shoulders, your elbows, your wrists, okay? First thing I'm going to be looking at is your shoulders here. They're of equal height, equal girth, which is good because they're sitting right about normal. There's no obvious deformity to your shoulders. I'm going to go ahead and push on them, like I said. Let me know if anything hurts, okay? Any tenderness?
No.
What about this side?
No.
No? All right, no tenderness upon palpation. I'm going to go ahead and move now down your arms just to keep doing that kind of motion, all right? Does that sound good?
Yes.
All right, any tenderness?
No.
Any tenderness in your wrists?
No.
No? Okay. Skin is warm and dry to touch. There was no obvious deformity, no edema felt, no excessive erythema or ecchymosis, which is redness or bruising. Like I said, there's no deformity, so I didn't feel anything abnormal. But to just make sure, we're going to test some range of motion, okay? This part's kind of fun. It's my favorite part of the whole thing. I'm going to have you bring your arms all the way forward. Great. Now can I have you bring them all the way back? Any pain with that?
No.
Do you need to stand up? You don't have to, but if you want to walk forward. No pain? Okay, great. And then I'm going to have you bring your arms up like you're a cactus and bring them down like a robot. Any pain with that?
No.
No? Okay. Next up, I'm going to have you put out your fingers, and can you spread them all the way out? Great. And then can I make fists? Good. I'm going to have you, this is called pronation to supination, and then do it back. Any pain with any of that?
No.
No? Great. We tested everything like that. Great. Now I'm gonna have you sit down. I'm gonna go ahead and apply resistance now, okay? Now we're testing your strength. Sorry. All right. First thing I'm gonna have you do, I'm going to have you hold on, and I want you to push down as I push up, okay? 1, 2, 3. Good. Now I'm gonna have you pull up as I push down. 1, 2, 3. Good. All right, I'm gonna have you, I'm gonna try to push in. I want you to try to push out, okay? 1, 2, 3. Good. And then opposite. 1, 2, 3. Good, okay. Shoulders, 5 out of 5 strength. Elbows, 5 out of 5 strength. Next up is gonna be your hands. So can I have you straighten? Yep, as tight as you can. I'm gonna try to squeeze them together. Don't let me, okay? Good, nice strength there. Next up, I'm gonna have you squeeze my hands as tight as you can. Good, 5 out of 5 wrist strength. Was there any pain when you did that? Okay, that's great news. All right, next up, I'm going to be assessing your hips, your knees, and your feet. So can I have you just roll your sweats up past your knees just a little bit so I can look at the skin? Okay. There's going to be no obvious deformity to the knees. I'm going to go ahead and touch your knees just a little bit. I'm going to bring them out. Okay. Patella is slightly movable on both legs. Good ligaments from what I can see. Next up, I'm going to go ahead and just palpate all the way down, okay? There's no erythema, no ecchymosis on the lower extremities. Like I said, no obvious deformity. As I palpate down, I'm going to stop and push a little bit harder on your shin bone. That's going to be assessing for edema. Does that sound okay?
Yes.
All right, I'm going to go ahead and start. And then can I actually have you stand up, please, since you're able?
Don't move them.
Yeah, you can drop them. Those are okay. All right, I'm going to go ahead and feel your hips here. Is there any tenderness? No? Okay, I'm going to come down to your knees. Any tenderness?
No.
And then your ankles. Any tenderness?
No.
No? Okay. You can go ahead and sit down. Thank you. Skin is warm and dry to the touch. Like I said, I'm going to go ahead and assess for edema here. Okay. No edema present, so that's good news. There's no swelling in your lower extremities. There's no tenderness upon palpation. Like I said, everything's in alignment. There's no obvious deformity to the hips, the knees, or the ankles. Next up, we're going to do your range of motion just to make sure, just because everything seems to be fine, but we want to double check. So the first thing we're going to have you do, can I have you bring this knee out to the side? Yeah, there you go. Good. Now bring it back in. Back out. In. Good. Any pain with that? No? I'm going to go ahead and do external, internal rotation of your hips just while we're sitting here. So it's going to be a little bit funky, but does that hurt?
No.
Okay, and then come to the other side, just like that. Nope. All right. Other one. Out. Nope. No pain. Great. Next, I'm going to have you bring your leg all the way out. Okay, bring it back in. Great. The other one. Back in. Good. Did the outside, inside. Okay. Next up, I'm going to have you point your toes all the way to the ceiling. Can you do that? Great. That's called our dorsiflex. And then put them down. Plantar flex. Okay. Then I'm going to have you, can I have you bring your heels inside, like towards the middle? Yep. And then now bring the opposite, your toes inside towards the middle. Good. Any pain with that?
No.
Okay. Next up, can I have you, this one's kind of weird. I'm going to have you tilt your feet inward. Okay. Does that make sense? Just like that. Yep. Any pain?
No.
Now go ahead and do the opposite. Outward. Any pain with that?
No.
Good. Full range of motion in the hips, the knees, and the ankles. No concerns there. Now we're going to do the resistance part, okay? So I'm going to get down here, and I'm going to try to push your knees in. Try to push them out, okay? 1, 2, 3. Good. And then opposite, I'm going to push them out. 1, 2, 3. Good. Nice. Next up, I'm going to test that internal, external rotation. So this one's going to be, might be a little silly for me, okay? So I'm going to bring it out. I want you to try to bring it in. I'm going to push it out, okay? 1, 2, 3. Good. Now I'm going to try to remove it this way. I'm going to try to push it in. I want you to try to bring it out, okay? 1, 2, 3. Nice. Good strength. Now we're going to do the same thing with this one, okay? So I'm going to try to push it out. You push it in. 1, 2, 3. Good. And then now we're going to bring it in. I'm going to try to push it out. You bring it in, okay? 1, 2, 3. What's wrong? We're going to do that one again. I'm going to try to push it in. You try to push it out, okay? 1, 2, 3. Good job. Messed that one up. Sorry. It's okay. The next thing we're going to do, I'm going to try to push this leg down. I want you to try to push it up, okay? 1, 2, 3, go. Good. I'm going to do the same thing with this one. 1, 2, 3, go. Okay, good strength. Now I'm going to do the opposite. I want you to try to bring it in,
Okay.
and I'm going to try to push it up.
Okay.
1, 2, 3. Nice. Same thing here. 1, 2, 3. Good. 5 out of 5 hip and knee strength. Now we're going to go ahead and go to your toes. Okay, this is the fun part. I'm going to have you push like you're pushing the gas. Okay, good job. Now I want you to raise your toes up to the sky. Nice job. All right, 5 out of 5 ankle strength. Everything appears to be good. Did you have any concerns or questions for me? All right, perfect. Thank you, Maddie, and I will be back in to check on you later.
Thank you.